want to take a moment to clarify a comment I made in a podcast last week about cancer that was misunderstood. I know that cancer can strike anyone at any time without any relation to lifestyle, especially kids. But not just kids. It happened to my mother-in-law too. She was diagnosed with ovarian cancer and only survived 3 months after diagnosis. And by the time they found out, she was so malnourished that they weren't able to continue her chemo treatments. That's why I became such a proponent of early detection, early treatment, nutrition, and holistic medicine. There are so many more options. If you diagnose early, then you can treat early. And that's what I was trying to say, albeit very awkwardly. But it's in that vein that is why I proposed health spending accounts, because we spend so much money on the back end when people have a disease that manifests, and we spend no money on the front end, on prevention, to keep people well. And so if we were to establish health spending accounts with $300 in them, we'd all be able to deal with the trauma of the last 2 years. Mental health, counseling, nutrition, dietitian, naturopathic doctors, chiropractors, physiotherapists. If we can start spending some money at the front end, I think it's going to be transformative in the system. And we will save money as people are not going into the system. And when we get into fall respiratory virus season, we're going to make sure that we have enough room to be able to handle that surge in patient load. That's the first step I'd take. I think every one of us who've had a loved one die of cancer have always said, gosh, if only we caught it earlier. The reason we say that is because we know that when you catch it earlier, there are far more treatment options. That was the intention of what I wanted to say. I know that that I-Corps Blood Services has approached the government to see if they would fund a pilot program into this $1,300 test. You know what? If I was Premier, you bet absolutely I would. Because I know that if somebody has a pre-existing condition, if they have some kind of genetic predisposition towards cancer, if they're beginning to see early symptoms, it will be the very best way for us to diagnose, and then we can get them the wraparound services that they need, the nutrition, the exercise, the additional support, as well as traditional chemotherapy and surgical intervention and radiation.